Hello everyone, Dr. Smith, physical therapist here. Today I'm going to break down the pros and cons of being a home health physical therapist. This is actually my second take of the video because I just filmed this whole video and my mic wasn't working. So hopefully there's no errors doing this video. Before I get into the pros and cons of being a home health physical therapist, please subscribe to the channel. Please hit that like button below. Please share the video if you find it helpful. And if you have any questions, comments, complaints, or concerns as the video moves along, please comment in the comment section below and I will try to get back to you as soon as I can. For those that are my subscribers or have taken my course, you know that I started out with a bad job in home health, then got a very high paying job in home health, and now make even more money and have helped many others do that exact same thing or just cut out that bad experience altogether. So when it comes to pros of home health, the number one thing is going to be pay, but it's going to depend. If you do not follow the guidelines I established in my Fair Pay PDGM video that I'll link below, if you're watching this on IGTV, you're gonna have to search for it or message me and I'll send it to you. But that is the baseline. If you don't understand that baseline, you're gonna have a bad time, especially if you don't get to those baseline rates and that baseline point system. So pay, in my opinion, is a pro if you do it correctly. As I've helped many others, you can see here, get up to $338K pre-tax by listening to what I have to say and learning how to provide value to agencies and also just hustling. But at the same time, if you don't listen to me and don't listen to other seasoned therapists who know how to get paid well, then you could be making $70,000 working full time and then somebody else is doing the same thing that you're doing or working less and making $140,000 plus because they did it appropriately. So when it comes to pay, it's going to be a pro if you do it correctly and a con if you do not do it correctly. Next thing is going to be paperwork. Paperwork sucks. In all settings, you're gonna have to do paperwork. The worst paperwork in home health is the Oasis. However, I'm gonna link some templates below. You can use these if you're going into home health or in home health, and they should help you with your paperwork. When it comes to regular visits, evaluations, it's pretty easy no matter what EMR you are using. Many of you that have taken my course have had me walk you through an Oasis in WellSky Kinzer or in Home Care Home Base, but most visits are easy if you just have templates, do it correctly, and just get it done the same day. When it comes to Oasis starter cares, it's really going to depend on the amount of medications the patient has, if they're diabetic, if they check their sugar, if they have injectable medications, things like that. The more medications they have, the longer it's going to take because you need to reconcile those meds, make sure there's no interactions. If there is an interaction, call the physician and advise the patient on what to do or have the physician advise the patient on what to do. So it's more complex, but all settings, you're going to be doing notes, even cash pay, you're going to be doing notes. Now, there's no law about doing notes, but for legal purposes, go ahead, do notes. I mean, schools are going to teach you how to be an employee anyway. Might as well do home health and be a high-paid employee. Use that capital to then quit, do your own thing, dick around like I do here, trade options, and make more money in a day just dicking around. So take that into consideration. But back to the topic, which is documentation. If you don't do it correctly, again, don't have templates, don't have a system in place, it's going to suck. If you do, it's going to be much easier. Again, you want to maximize your ROI, your return on investment. So the less time you're spending doing paperwork, the more money you're getting per hour, more time, less per hour. Next topic is schedule flexibility. Now, if you're able to maintain a schedule, able to map out patients, if you don't know how to map out patients, check the 2 other videos on this channel teaching you how to do just that. And what you can do is you can start far, come back, or start close, go around trying to make a circle, learn how to map out patients. What I tell people is when they're scheduling their patients, to give them a 2-hour window. If you say you're going to be there at 11 o'clock and traffic or other things happen or a patient has an emergency, guess what? You're not going to be there at 11 o'clock. It's going to look like you lied to the patient. It's going to set a bad example for you and the agency. So try to say, 10 to 12, 12 to 2. And if they're close together, you can overlap those times. More importantly though, don't let patients dictate your schedule. Tell them when you're going to be there. They can take it or leave it. That may sound dickish, but you'll understand why when everybody requests at the same time and you can't accommodate everyone. So make sure you do not let patients dictate your schedule. Same thing here. If you let patients dictate your schedule or someone else dictate your schedule, like you're probably burning out in ortho right now or acute care or something like that because someone's dictating your schedule, you're going to burn out quickly. If you make your own schedule, It's a huge pro. You can stop, get groceries, take your cat to the vet, go to the doctor, do these things, schedule your patients around your workouts, whatever you want, because you have that autonomy that we all crave. Now, yes, documentation sucks, responsibility sucks, but you're gonna have a lot more autonomy and you're gonna have to be self-driven. So if you need your hand held because you can't take mommy or daddy's titty out of your mouth, then it's probably not the best situation for you. And again, I don't recommend everyone do home health, but if you want to do it, you need to understand the fundamentals. Additionally, with that flexibility comes getting paid for mileage. Now, unless you are an independent contractor or a company that is contracting, you cannot write off that mileage on your taxes. I know people still tell you that you can. That is not true. So make sure that if you're not getting paid as a contractor, that you are getting paid for your mileage, because you will not be able to write that off and you need to be compensated or else you will be losing money. Now that I've covered pay, documentation, flexibility with some mileage sprinkled in, we're going to talk about responsibility. You're going to have much more responsibility as a home health therapist when it comes to patient care as compared to outpatient. And that's not a bash at outpatient or anything like that, but you're going to be having weekly case conferences with RNs, OTs, MSWs, and learn how to manage the patient as a team. Additionally, when you do a start of care, you're going to be doing wound checks, wound management. You may be doing wound care depending on your agency. You're going to be reviewing medications. You're going to be getting their height, their weight. In some states, doing a literacy test to make sure the patient has adequate health literacy to understand what's going on. And you're going to be acting more as an evaluator and an assessor and doing things more so as a charge nurse or maybe even a PA would do when you're doing a history and physical. So realize that you're practicing a bit differently. And again, this is probably not the standard employee model that schools taught you, but you're going to be learning how to manage the patient more. It's more medically complex, and in my opinion, you're practicing at the top of your license. Now, you can still do treatments in any visit type, but you're most likely going to pass off these other visits to PTAs and continue with starter cares and evaluations. Now, you may say, hey, well, I want to do everything. I want to be with the patient. It depends on your census. If you have, 80 patients, that's going to be very hard, but also realize that, again, if you do it correctly, by doing starter cares and evaluations and passing off these other visits, you're going to be making more money. And my goal at the end of the day is not to tell you to go be a physical therapist forever, not be a home health physical therapist forever. It's to learn how to do things appropriately, to maximize your return on investment so you can build capital to go and do your own thing. Many home health therapists went into home care to make money, to get capital, to then start their own cash pay practice. Some went and did other things. Some play around in the stock market. Some just stopped altogether and did something else. But it's a great way to supplement your income, even if you do it PRN. But if you do it full-time or have a PRN contract and work full-time, there's lots of money and lots of opportunity. So realize that, again, my goal is not telling you to be a therapist forever. I want you to learn how to get paid and learn how to maximize your return on investment. And if you can do that, then home health is going to be a huge pro. But if you can't do that, you don't understand what's going on, and you want, to suck on mommy and daddy's titty, then it's going to be a con for you. All right, guys, I'm Dr. Smith, physical therapist. Thank you for watching. I appreciate all my subscribers, and I'll see you guys in the next video. Please message me with any questions. Again, my main platform is YouTube, but I do cross-post this to IGTV. All right, guys, thank you.